Good morning, good afternoon, good evening from wherever you're watching, and welcome to another episode of Something About Surgery. Today, we will talk about an important document called the Informed Consent. Before any surgery, a patient must sign an informed consent. Now, what does this consent entail? The first is the diagnosis. What is wrong with the patient? That must be written in full, not in abbreviations. The second, and very important, is the mental state of the patient at the time of giving consent. The doctor indicates whether the patient is fully alert, conscious, and oriented, and of sound mind to give an informed consent. Very, very important. The next is the procedure, again in full, not in abbreviations, and who to perform it. Sometimes it is indicated a member of the team and the team. For instance, Dr. Ruyaru and the team in terms of the surgeon operating, if it is the setting of a big hospital with a big surgical team. The next are the benefits of the procedure and the associated risks. Why should this patient have this procedure? Are there risks involved with this procedure? And after discussing that, you must again indicate the consequences of the patient not having the surgery, because some people would opt to stay with their diseases without surgery, and it is important that it is indicated that the patient understood if they opted out of surgery, what would be the consequences. Closely related to that are the alternatives to the procedure. Can the patient have medicine instead of surgery? Can they have another procedure instead of surgery? And how do those alternatives compare to the surgery that they are consenting to? And finally, the signatures. The signatures are from three key sectors or quarters. The first one is the surgeon or a member of the surgical team on behalf of the surgical team. The next is the patient or their guardian. If the patient is a minor, if the patient is not of sound mind, then they have a close relative who acts as their guardian. It might be a parent, it might be a son or a daughter, you name it. In a few instances, the doctor is authorized to act as the guardian if he cannot trace any relative to offer consent for that patient in the setting of a dire emergency. And the final person to consent is a witness. Now, a witness is any member of the health team who is not a patient and who is not the operating team. They sign in as witnesses to this agreement. In a nutshell, therefore, we've said an informed consent for surgery must contain the diagnosis of the patient. It must contain the mental status of the patient at the time of giving consent. It must indicate the procedure to be performed and who is going to perform it. It must list the benefits and possible risks associated with that procedure. It must indicate the consequences of the patient not having that procedure and list if there are any alternatives to the procedure that has been indicated. And of course, it must be duly signed, dated, and timed by those three people that we've mentioned. That is the informed consent form for surgery.